Hello and welcome everyone. This is the South Coast Interfaith Council series of courageous conversations over coffee. And throughout the series, we hope to bring you a glimpse into the lives of people who are, I think, truly courageous, meeting the challenges of the current situation with what I'd call creativity, grace, generosity, and hope. And my name is Marietta Fong. I'm a member of the board of the council, and I belong to the Rolling Hills United Methodist Church in the South Bay, Los Angeles area. And this series has been to me an impressive opportunity to hear from some amazing people, to learn about some of their challenges, and to find some inspiration in these intimate and honest conversations. Today, we're really fortunate to have Dr. Omer Deen as our guest to give us some light on the pandemic from his perspective. And we'll hear more about Dr. Deen in a moment. So first, we'll have a few tips from Cheryl, the council's office administrator, about conducting a successful conversation in Zoom. Cheryl, would you like to share your screen and how to do this? And unmute yourself too.
Thanks for the reminder, Marietta. So can everybody see the screen? Good. Okay, so we're Zooming today. I'm guessing that by this point everybody's has Zoomed at least once through this pandemic. So we're going to have everybody stay muted during the conversation. And if you have any questions for Dr. Deen, please submit them in the chat to Marietta, and she will ask them as the conversation progresses. You can also use the little symbol down at the bottom to raise your hand if you have a question. We're going to be recording this in what's called speaker view, but your picture may be in the corner of being recorded. So if you would like to, have your video present as best as possible, it's best to have a light on in front of you and no lights behind you, because that would darken your face. So even though we've done a few of these, we are still learning, so be patient with us, and those are the guidelines. Back to you, Marietta.
Great, thank you so much, Cheryl. So the program will be about 45 minutes, and first we'll have some conversation with Dr. Deen, and then during a Q&A section near the end, you can have an opportunity to send questions, as Cheryl mentioned, through the chat box located at the bottom of the screen, or raise your hand. So to tell you a little bit about our speaker today, Dr. Deen completed his residency in internal medicine at the University of Nevada, Reno, then a fellowship in the digestive disease and clinical nutrition at Cleveland Clinic. And Dr. Deen has had experience treating ICU patients and has been seeing the COVID-19 patients since the beginning of the pandemic. Some of his leadership positions include being a fellow of the American College of Gastroenterology and a fellow of the American Gastroenterological Association, and an executive board member of the National Board of Physician Nutrition Specialists, and an executive board member of the Los Angeles County Medical Association, and a delegate to the California Medical Association. Some of his political work involves working in Washington, D.C. with the Congressional Committee for Healthcare Reform since 2010. So, Dr. Deen, would you start just a little bit by telling us about your practice, your private practice that you're involved in now, and what that consists of? What kind of patients do you see? How often do you see them? Kind of the picture before all this pandemic started. Is that okay? Oops, is he still here? There, you're muted. Oh dear, try again.
Is that better?
That's much better, thanks.
So my subspecialty is in clinical nutrition. So as my kids will tell you, I rub people's bellies and I feed them. Um, so basically, my practice is all inpatient. I don't do outpatient. I'm only in the hospital. And I see patients who have a host of diseases. So digestive disease could range from, intestinal dysmotility, pancreatic issues, pancreatic insufficiency, intestinal malabsorption. Um, sometimes it's as simple as patients who just are elderly and are unable to eat, and sometimes they're unable to absorb the food that they're eating. And so often that requires creative ways of coming up with feeding these patients. So from that standpoint, I kind of have a specialty where there's a broad spectrum of patients that are in the hospital that I could be treating. And it's really the whole spectrum from malnutrition all the way to obesity and bariatrics and gastric bypass and things like that. So when this whole thing started, when we started seeing COVID patients, this was a new virus and a new disease. And we're seeing people that are either very, very sick in the ICU on, mechanical ventilatory support, so on a respirator, and then other patients who are doing quite well and handling it pretty well. Now, amongst all specialties, we didn't really know what to expect. Because it's a new virus, are we going to see cardiac complications? Is there going to be something unique to the digestive tract that is going to affect these patients? As you've probably heard, we've seen an increased rate of blood clots in the legs, or strokes and heart attacks, things like that. So a lot of these things we don't really have an explanation for, so it's been learning as we go. And from my standpoint, from a nutrition standpoint, a lot of the early research has gone into, are there certain things, high dose antioxidants, vitamins, things that will help to slow the progression of this virus or to slow the severity of the illness? And that's kind of what we've been focusing on to see these patients in the ICU especially.
That's really fascinating. I'm just wondering, so now where do we stand as far as the current status and kind of the progress of the pandemic? I mean, what are the trends that you're seeing? What kind of a trajectory can you imagine?
I hate to be the bearer of bad news, but over the past 2 weeks or so, we have seen an uptick in the number of cases. We had started out, obviously very busy and very concerned because we didn't know how high the peak was going to go. But that number has been steadily declining up until, I'd say, the past week and a half to 2 weeks. We've seen kind of an uptick. Now, part of that is as people start relaxing the rules and going out more and mingling, not everybody's wearing a mask. Not everybody is maintaining social distancing measures. And so that has really caused people to, sorry, there's a bee in the car here. That has really caused people to, I guess because of their getting relaxed in their social distancing measures and not wearing masks and things, we are seeing a little bit more of an uptick in cases. So the concern is with Memorial Day weekend, with people being out for that, and then of course with the riots and what's been going on politically recently, there's a lot more people out and about, a lot closer proximity. Not everybody is maintaining good hand washing and distancing and mask wearing, and so I think all of that is contributing.
So you can really see, or do you think that there is a specific correlation to people's attitudes and behaviors, such as the opening up of things and the protests and so forth, that have really significantly shown an uptick in the incidence of these things?
Yes, and it's not just here. Actually, we've been doing pretty well, I think, in Southern California so far. Of course, like I said, we are seeing an uptick in the number of cases, but places like Utah, Texas, Arizona, I think Arizona reported their highest ever number of new cases this past weekend. So they're seeing quite a bit. And I think there's many factors that go into this. I mean, it's not just that we should all be at home and not go out. I think that we are, that's natural to try to kind of reopen the economy and get people out and about. But I think it's important to do it safely. I think the concern is that there's a lot of people that are, frustrated, impatient, tired of being cooped up at home. And so there is a little bit, there was a lot of fear and anxiety up front when this pandemic started. And I think that led to people kind of self-isolating and being extra cautious. And I think that's kind of waning now. I think there's some attitude of just, you know what, let's just live our lives and we'll see what happens. And then there are some people that are just defiant. There are some people that say, I refuse to wear a mask. I'm not going to do that. So all of that plays a role.
Oh, wow. So what's the mood and morale of your colleagues? And how I can just imagine there must be at times a physical and almost emotional exhaustion over such an extended period of time. How are you doing? How are you and the folks in the hospital dealing with all of this? What's it like?
Well, it is frustrating to not, you kind of go through training and you learn what you're going to be seeing and how to treat it and how best to manage patients. And then over years of experience, you fine tune ways of treating patients. Again, the difficulty here is, and my colleagues who are infectious disease specialists and pulmonologists will certainly, they're bearing the brunt of this far more than me. But they'll also attest to this, that you end up, you're kind of in the unknown. We don't know how to treat this. We don't really have documented trials and studies for years showing that this works well or that works well or how to manage these patients. So it's a lot of trial and error. And I think the frustration is kind of twofold. One is, of course, the physical frustration of the extra PPE and being cautious and being stressed out about, am I going to take this virus home? Mm-hmm. Am I going to get it? Is it on my clothes? Are my kids going to be affected? Is my family going to be affected? So that obviously is stressful. And many of us are, we're no longer wearing shirts and ties. We're wearing scrubs, and we shower in the hospital before we go home, or as soon as we get home. We kind of all have we call it a decon method of how we kind of get home and take off our clothes in a certain order. They all go in the wash, and then we go in the shower, and there's a whole process. So there's obviously the exhaustion from that. But I think the mental exhaustion has been mostly with the uncertainty and the inability to predict how certain patients will do. There are certain trends that we've seen that we do tend to adhere to. There's, for example, patients who are diabetic or pre-diabetic and have obesity. In my experience, in our experience here, we have seen a much harsher disease in these patients. They get sicker, far sicker than people who aren't obese or don't have diabetes, and also they tend to be sicker longer. Of course, as you've probably heard in the news, chronic, lung disease or heart disease, obviously, age puts you at risk. But for cases like that, we occasionally have cases of people in their 20s who are seemingly healthy, who don't have any issues, who end up on the ventilator and end up, in critical condition for an extended period of time. So that uncertainty of not knowing, we'll see patients in the emergency room, for example. My colleagues in the emergency room will see a patient, they're tested, they're positive, but they're doing quite well. They're oxygenating well, their symptoms are mild or manageable. And so we send them home and we say, self-quarantine, stay at home, don't be around other people. But, sometimes they do well, and other times they come back in 2 or 3 days, and now they're much worse, and they require intubation, and they require an ICU stay and things like that. So from that sense, it's difficult. And we don't have a treatment. We have a few methods that we're using that are anecdotal at best. There are some early studies showing that there's an antiviral medication called remdesivir, which seems to be helping to shorten the duration. It's not a magic bullet, but it's the best we've got, and so we're using it.
Wow. Well, speaking of treatments and things coming down the pike, everybody is asking that question. How close are we to a vaccine? What do you think?
I wish I knew. I wish if I knew, I would be in the stock market. There are multiple companies around the world that are working on a vaccine. There's many factors, and we can get into this a little bit. There's many factors that make it difficult to create a vaccine specifically for this virus. I know there's a lot of funding, both federal and private, that's going into this. There's a couple of companies that seem to be ahead of the pack right now, and I don't know if they're being overly optimistic, but we're hearing that maybe even by the end of the year they might have a vaccine. I would just caution that having a vaccine is different than having the ability to spread it mainstream and for everybody to have it and be able to get it. So that might take a little bit longer, but I would count on a year to a year and a half.
Wow. And do we even know that well, maybe if you've had the vaccine, that's one situation, but if you've had COVID-19, do we know yet if that makes you immune as far as getting it again? Or do we know if that means you can't be a carrier to other people? Are there still questions in that area?
From what I've seen, there's pretty limited data on that. But what I can say is it varies person to person. There are people who have had COVID, who've survived it, and when you check their blood levels, they do have antibodies, which means there's some degree of immunity to getting it again. I say that cautiously, and there's a few factors that we can get into about that. The concern is that it doesn't seem to be permanent, that those antibodies that we make hang around for a while, in some people weeks, in other people months, and we don't know about years yet, but it does tend to kind of come down. So that number of antibodies tends to kind of wane over time. And so does that mean that you could potentially get it from the same strain again, a lot like we get the flu? That's what it's looking like. You know, just as when you and I get the flu, we'll be sick for a while, we'll get better, but you're not immune from the influenza virus. You could get it again the following season or the following year. So that's an issue. Secondly, there's multiple strains of the virus. So if you get one strain, yeah, I think there's now the experts will know more about this than me, but last I saw there were about 14 different strains of COVID, and they vary. There are different strains in different parts of the country, and often they can check these strains to see where they came from. For example, they were able to pinpoint that some of the early strains, excuse me, that came to the U.S. did not come from China. In fact, they came from Europe. So all of these things play a role. So if you get infected by one strain, that doesn't mean you're immune to the other strains. The assumption is that those other strains will not cause as severe an illness, hopefully, subsequently. So if you've had COVID and then you get it again, it shouldn't theoretically be as severe of an infection or illness as you had the first time, because now your body has some degree of recognition where it'll pick that up. And again, a lot of that is guesswork.
Is that similar to what you'd experienced with a vaccine? Am I way off with that?
So that's a good question. So again, my knowledge on that is a little limited, but I would say that this is an mRNA virus as opposed to a DNA virus. And what some of the vaccine manufacturers are working on is trying to figure out if there's a way to code for that DNA, meaning if that vaccine can somehow cover multiple mutations and strains of that virus. That's a big if. We don't know, because it's new technology. It hasn't been done before. We don't know that we're going to be successful with that. It would be fantastic if we are. But we should theoretically at least be able to do what we do with the influenza virus, which is we can have multiple different strains within the same vaccine. So much like you get the flu shot now, where you get the flu vaccine, and it is good for certain numbers of strains of the virus. And scientists will study that in advance to say, you know, in Australia, for example, there are these 2 or 3 strains seem to be prevalent. So as the seasons change, we are likely to see these strains here. And that's how they decide which strains to vaccinate against. And so at the very least, hopefully we should be able to do that, which may mean that you don't get a permanent vaccine from this like you do for polio or, you know, a lot of these other diseases, measles or mumps. But on the other hand, you might get a flu vaccine in one shoulder and you might get a coronavirus vaccine in the other shoulder. Who knows? It might happen every year.
Oh my goodness, that is so incredible. It's so hard to fathom.
Yeah.
So I have a couple of questions in mind. One of them I'll ask is, what do we do about what appears to be misinformation about all of this? Have you been thinking about how people are getting so many different sets of facts, and some of them are right on point and some of them are pretty far off?
Yes, of course. And so obviously, I don't want to get too political, but in our political climate, obviously, there has been a lot of misinformation, and it's coming from various sources, including sometimes the government. I had a patient actually this morning, that asked me that I heard that organizations and hospitals there are falsely claiming that there are more cases than there actually are, that somehow it's in the interest of hospitals and doctors and clinics to claim that there are more cases out there than there actually are. And I was a little surprised to hear that. And I said, you know, in my experience, it's actually the opposite, that what most of us medical personnel will tell you is that there is a far, far higher amount of this virus and infections and cases and even deaths than are being reported or that are being acknowledged. And the reason is that there has been a very slow uprise in the number of tests. Of course, the availability of the test was an issue early on. And then we faced the issue of how many of these tests are accurate. Are we seeing false positives? Are we seeing false negatives? Things like that. And now it's more that, you know, there needs to be some regulation as far as from the healthcare industry, as far as who to test, how often to test, right? And so the argument is that on the one hand, people with very mild disease who have very mild or no symptoms, do we need to stress out about testing these people just for the sake of documenting it? Of course, it would be nice. It would be nice, ideally, to know exactly how many people have it, where the pockets are, where are we seeing these cases, so that we can plan. And where do we need to be most aggressive with PPE and social distancing, and which counties should stay closed and which ones can we open up restaurants and stores and things like that. So from that standpoint, of course, it would help, but the feasibility of being able to do that is very difficult on the ground. So to go back to your question, yes, there is some misinformation out there. There's a lot of rumors, you know, that you can get it from clothes, that you can get it by just walking around outside, you know, and so you kind of look at, we all have to live, we all have to work, we all have to kind of keep our sanity. But then there are some basic things that we can do to dramatically decrease the risk of getting the infection, and dramatically decrease our chances of carrying that forward and transmitting it to somebody else. And those are basic things that we can do. Things like good hand washing, good hand hygiene, maintaining at least a 6-foot distance from each other whenever possible, wearing a mask, and wearing a mask properly. I see a lot of people wearing a mask the wrong way. You see people with their noses hanging out and the mask is over their mouth, or it's on their chin because they can't breathe or they don't want to be muffled when they speak. And so all of those things play a role. It's not going to help you if it's on your chin or on your head. It needs to be over your nose and your mouth, and so those types of things.
Well, you answered one of the questions I was thinking of, is what precautions should we be taking still at this point? How do we judge what's safe, what isn't safe, what do we do to protect not just ourselves, not only ourselves, but other people in our community, and still engage with other people as we are allowed to, as we should, as we'd love to? What else do we need to know?
I think those things that I mentioned are important. And at the end of the day, you have to kind of weigh the risks and benefits of what you're doing. So we'd all love to be on the beach in the summer. We'd all love to have get-togethers and dinners and go to restaurants and things. And I think gradually, as the number of cases has come down, to go out and open up stores and restaurants and be out and about a little bit more, I think is acceptable. The concern is everyone needs to follow all the rules and be cautious about it. And those of us that are at highest risk, the elderly, people with pre-existing conditions, cardiac disease, lung disease, smokers, obesity, diabetes, things like that. You want to try to avoid unnecessary risk. Don't go out if you don't have to, and if you do go out, make sure you're extra cautious. Um, Notice now I mentioned hand hygiene, social distancing, and wearing masks. I didn't mention wearing gloves. I see that around a lot, and I actually think that is not a good idea to wear gloves. You're not going to get it through your skin by touching things, number one. Number two, wearing gloves, you're less likely to take the gloves off and get new ones as often, and you're less likely to wash your hands if you're wearing gloves. So you may feel protected, but you're touching everything and touching other things and passing bags and things to other people, a lot of store clerks and things, and you haven't washed your hands in a long time. And so that may make you feel safe, but you're not necessarily helping everyone else. So I don't think that's necessary.
Wow. Well, I have some questions that have come in the chat box, and I don't know the best order, but I'll jump onto one of them that's related to babies. It says, well, babies can't wear masks. So how safe is it to take them out and about, like to a park or a walk around the neighborhood? What do you do in a case like that?
Yeah, it's tough. If your child or baby can wear a mask, I would encourage wearing a mask. Um, if they can't, two things. One, I think it's okay to be out as long as you're maintaining a distance. So I do see a lot of people kind of walking around the neighborhood. Child is in a stroller, but they're not around other people. They're just taking a little walk, and they make sure to maintain a distance, and then they go home. So that would be okay. Secondly, at least from what we've seen, younger children tend not to, this is generalization, they tend not to have as severe of a disease, and sometimes they're asymptomatic completely. So if they do get it, obviously nobody wants their child to contract COVID, but they tend not to have the severe advanced cases of the disease generally.
Okay, thank you for that. We have a question about visitors in the hospital. Deborah says, I heard there were restrictions on visitors in the hospital, and she's asking, does that apply to everyone in all types of disease, or is it being more relaxed now for people who are in other areas of the hospital?
That's a great question. So that is true. For the past, I think, 3 months, we had stopped all visitation in the hospital. So no matter who was in the hospital, if your loved ones in the hospital, we did not allow any visitors to come in. And that was strictly for, distancing and precautions. So we didn't want the virus coming in with somebody who may be asymptomatic and carrying it into our patients, which would then potentially spread to other patients. And also the other way around. If we've got COVID patients and cases in the hospital, we didn't want to risk the safety of the public by having people come in and they might contract it there. Recently, we have started on a select basis, like a very small amount. Of course, end of life, hospice, withdrawing care, things like that. We have allowed that. And more recently, case by case, we do kind of consider having visitation. So I have noticed some people in the hospital who are here to visit now, but it's not back to how it used to be.
Well, for example, on a personal level, my daughter had a baby Monday, and her husband was allowed to
Congratulations.
come in and be with her, but they told him she'll be here for a few days, and if you leave, you can't come back in. So he just stayed the 2 or 3 days with her while she was in the hospital. So I
Right.
suppose that's the kind of exception, but none of the rest of the family could come, of course. Just one person could be there with her.
Yeah, I've heard different rules at different hospitals. I've heard from some people that they're not allowing spouses to be in with, when women are giving birth, that you're not allowed to go in for the delivery, and then other places are allowing it, but not allowing you to leave, come and go. That's true.
Mhm. Okay, let's see. There's a question about nutritional supplements, and it says, what have your clinical observations showed so far regarding nutritional supplements in people's diets and the severity of the illness if they get infected with COVID-19? Is it a good idea to have taken some of those and have that kind of a habit, or does that seem somewhat irrelevant?
Um, I don't think we have data. I think I would be guessing if I were to recommend supplements. What we have seen, there are some studies that are ongoing. They're not particularly strong, but they're regarding zinc supplements and vitamin C. That high dose vitamin C and zinc may be helpful. There's one study where it was in vitro, so it was not in living patients, but looking at cells, that the mRNA polymerase, which is the component of the COVID virus that replicates, it's responsible for viral replication, that activity is inhibited or slowed by intracellular zinc, meaning zinc within the cell. And we don't really have a good explanation as to why, but it's enough that for patients that I'm seeing in the hospital, I tend to put them all on zinc at least for 10 days to 2 weeks, high dose every day to see if that helps. And the other is vitamin C. Now, high dose vitamin C has been studied for a long time for septic patients, bad infections that are, involving the bloodstream. And so some studies do show that helps to shorten the duration of how sick patients get. So we are using high dose vitamin C also. So those are two things that I am actively doing for our patients that are infected with COVID, especially the ones that are sick enough to be on a ventilator in the intensive care unit.
Oh, that's really, really good to know. That's really interesting. There's a technical question, and the person is asking, nationally, cases are continuing at a high level while deaths are dropping. And do you have an explanation for that? They're theorizing it could either be related to more testing, so more diagnoses, or maybe better treatment protocols, so less deaths, or that
Yeah.
the virus is mutating to be less deadly, or with social distancing, people getting a lower viral load and therefore less severe cases. What do you think?
I think all of those are possibilities. I think with the exception of that last part, I think that the viral load isn't really, you either get the virus or you don't get the virus. And if you get the virus is going to do everything possible to replicate as many copies as it can in its life cycle in your body. I think that social distancing has helped. I think that from our treatment, we have gotten more aggressive earlier on. I think since we started treating these patients to now, we have learned that the sooner you get aggressive and the quicker we get these patients recognized, diagnosed, and kind of supportive care and treatment, the better they tend to do. So we are doing those things. Now, as far as the death rate decreasing, I think, I see some reports, news reports in some parts of the country where deaths are increasing. I think overall COVID deaths, obviously that number is increasing. And I think as cases go up, severity goes up and deaths go up. But I'd like to, pat myself and my colleagues on the back a little bit that I think we are getting a little more accustomed to seeing these patients, recognizing it early, and treating them often empirically. We start treating them before we even have results of the test, thinking that let's start treatment, we can always back off later, but let's get aggressive early on. So I think that's helping as well.
Ah, thank you. Well, are there any more questions from the people that are in the Zoom meeting? And if so, you could raise your hand or send something through the chat box. I can't tell you how grateful we are to you for sharing this information. One last question that occurs to me is that we talked a little bit about the misinformation, and I'm wondering, what are the trusted sources that you would go to? If I wanted to find out what's really going on, I have a question, who can I trust and where should I look?
That's a good question. So I think that the most trusted source for most people in the public should be the CDC. And if you go to the CDC's website online, I think it's cdc.gov, they will post bulletins, important updates, any changes to the rules and regulations, and anything new will come up there, as well as I think some statistics about where the cases are, where they're being reported, and so all of that is important. The other is kind of your local mayor's office or your local kind of websites where they will report what the state of your county is. Are they opening things up? I know that for Southern California, for example, Orange County has opened up already and opened up sooner. So businesses, I think nail salons, restaurants, car dealerships, things like that, they opened up sooner in Orange County than they are in LA County. So things like that are helpful. I know that Dr. Anthony Fauci with the CDC has been doing a lot of speaking and a lot of interviews, and those are obviously available on YouTube and various media sources. And so I would trust those sources. I think the issues come up when it's kind of word of mouth or hearsay, and in cases like that, you don't know what to trust. You don't know how accurate things are. A lot of times it's going to create more paranoia and anxiety, and oftentimes it's far worse in its reporting than reality. So that's also something to consider.
Thank you. Let me ask you, what would you say is the most helpful thing that you hold on to every day, either in your experience or some place or something that you go to when you just need that little boost to keep you going and you're thinking of something that gives you hope?
That's a great question. I hadn't really given it much thought. I would say there's two things. Number one, I personally have a deep faith in God, and I believe that we are not given obstacles that are beyond our capacity to handle, and there's a lesson in everything. And so if this is allowing us to be more mindful of God, number one. Number two, to be better in our learning and our desire to advance medical knowledge and to improve the ability that we have to care for patients and to learn from this for the future. I think that is important. I take solace in my colleagues. I think the lung specialists, the infectious disease doctors, and the hospitalists, a lot of other doctors that are taking care of these patients, I see their strength and I see their dedication, and that helps me also. And I think we kind of fulfill that role for each other. And then people. I think just talking to people like you and to the community, and how it has made people come together. People are helping each other. Neighbors are looking out for each other. There's people going out and getting groceries for their neighbors, especially when they're elderly and when they, it's riskier for them to go out. So these are the types of things that I think it's hard to see initially, but I think amongst or with every calamity or hardship, there are lessons and there are things that draw us closer together. And I think those are the things that we need to focus on, and not the fear and the anxiety. As long as we're doing the best we can, that's really all we can ask.
That is a really great comment. And I think really, if ever there was a time for faith and a time for unity, this is it. I'd say part of the mission of the South Coast Interfaith Council is to draw us all together and to learn from each other and to share the strengths and resources and the beauty of our various faiths and to share inspiration and hope. So I can't thank you enough, Dr. Deen, for sharing with us today in such a beautiful way. And thank you to everyone who's in this conversation who've taken time to listen, to join in this courageous conversation, and to share hope for healing and grace. I think is this probably a good time to talk about what we have coming up next week and a little bit about the organization. So Melia and Cheryl, if you'd like to share some things regarding that, what's coming up. I see the slide.
Yes. Yes, slide. Amelia, do you want to talk to it?
Sure. Do I have to? No, of course. Yes. So next week we have, thank you so much, Omer. Thank you, Dr. Deen. Thank you so much for being with us and your time. I know that you're extremely busy. Next week we're kind of following up in similar ways and obviously still talking about the pandemic and the virus, but we wanted to focus on the youth and just kind of talk to the youth and how it's affecting their psyches. I know recently we see a lot of pictures of graduations and, when they don't have, a lot of seniors and junior and, going from middle school to high school, all those kind of rituals that are really important in life. These young individuals aren't able to really experience them definitely the way that most people do. So we want to just talk to them and just kind of get an idea about how their faith is also helping them kind of navigate through everything that's going on. So that'll be next week at 3 p.m.
Thank you, Amelia. Can you tell us a little bit about the South Coast Interfaith Council and how people can perhaps support this series and the program and the things that the council is doing?
Definitely. So I think Cheryl has another screen as well. Like all nonprofits, right now, I think the pandemic, there's so many ramifications of it. And one of it is certainly that it's, a lot of the nonprofits are hurting because donations are down and things like that. And, most certainly the Interfaith Council is in a similar paradigm. So, all these programs that we're doing, our goal is to serve the community even amidst this pandemic and hopefully make it, a little bit more bearable, and so that where we can have a sense of community even though we're not physically together. And that's really the reason behind all our programs. So if you are able to, we would be so grateful, if you would go to our website and there's a link there for donate and just, if you're able to donate, we would love that. No matter how much or little or how big, we would really greatly appreciate your support so that we can continue doing these programs in the months to come.
We also had a question.
Oops.
So there is a YouTube channel for the South Coast Interfaith Council, and we've been recording this session. You can access that and you can share that with your friends. If you have the need to take a look at it again, listen to more of the information, or share that with other people who would benefit from it.
And subscribe.
Subscribe to that channel. Yeah. Well, there are several other things that are going on that the council has been involved in. I don't know, Amelia, did you want to tell us a couple of the things that are going on besides the Friday afternoon conversations?
Yeah, sure. So we basically have kind of 4 things that have been, since kind of the onset of this pandemic or the Safer at Home initiative, we've implemented these 4 programs. One is we have daily inspiration that, goes through the medium of our social media, but also if you yourself would like to personally receive that, please send us an email at office@scinterfaith.org, and we're happy to share that via email every morning. The other thing is every Monday we have a program called Silver Linings, Finding Hope Through Faith. And the whole premises behind that program is really talking to individuals who espouse various different faith traditions and seeing how their faith traditions are helping them to really kind of find hope amidst this time that we're all living in. And then on Wednesday, our president and also Omer's lovely wife, Sarah Deen. She spearheads this program called Custodians of Care, helping the helpers. And really the idea behind that is, there's a lot of people doing really great things and a lot of organizations out there. And what we want to do as an Interfaith Council is showcase that what they're doing and also seek ways that we can assist them or help them. So Sarah every week interviews someone from another organization and talks about what they're doing. And then at the end, we kind of have an ask that we give, that we share with our community in terms of how the interfaith community can be of help to these various organizations to fulfill their missions, particularly at this time. And then, of course, the courageous conversations. Thank you, Marietta. And I know that Pastor Jonas is off to get his doctorate degree and not here for a little bit with us. And most certainly Cheryl, for leading this initiative on Fridays as well.
Thank you, Melia. So thank you everyone for being here today. And Dr. Deen, did you have any closing thoughts, anything that you would like to add that we haven't covered perhaps?
I just wanted to thank you for this opportunity. It's been great speaking with everyone, and I hope everyone's staying safe, and I hope I was able to answer some questions. I'm always here. Feel free if there's anything else I can do to help or any other questions I can answer. Thank you all.
You're so gracious and kind. We really appreciate it. And we hope that you're finding these programs to be nourishing, thought-provoking, and inspirational. So if you do, check it out, subscribe to the channel, and we'll see you next time. Thank you so much.
Thank you.
Thank you.
Thank you, Marietta. Thank you, everybody.